Good morning, ladies and gentlemen. I, I would like to give my sincere gratitude for the Gari and their team to giving me this opportunity to present my findings. This is a study which I have done my PhD to develop a protocol for medical legal examination, reporting, and management of female survivors in intimate partner violence in Sri Lanka. Uh, so this is the introduction. Intimate partner violence is an emerging issue in Sri Lanka. Mainly, it's a social issue. Previously, it was thought as a private matter, but it is coming into the field. And because earlier it was thought as a private issue, as there were so many sensitive and confidential issues involved in the subject, and as a result of that, it was largely underreported previously, and there is no proper guideline to handle of these cases during the medical legal management in Sri Lanka. So just I will give you a very brief overview about the violence and where the intimate partner violence stands. So the violence broadly categorized self-directed, interpersonal, and collective. The interpersonal violence is happen among the family and the community. So this is we called domestic violence. Family violence happen in the family. It involves child abuse, partner violence, and elderly. So the where I focus here is the intimate partner violence. So the intimate partner violence among the partners could be physical, sexual, psychological, and various controlling behaviors happen. So it's like this. In the family setup, this is I called associated risk factors. So there are many people living the risk factors. It's like a bomb. No bomb will explode without a trigger. So there are triggers in within the family. So people may be living happily with the associated risk factors. I will come into that. And once the trigger meets with these associated factors, you get the consequences and the violence. So as it's like this. So the associated risk factors for the intimate partner violence, socioeconomic factors such as poor environment, poor education, low income, the women unemployment, and the husband's poor education, various issues involved there. So I just given the heading only. The factors related to the both partners may be psychiatric illnesses or general physical illnesses may be involved there. So then the factors related to the partnership of both individuals, for example, longer the period they stay within the family, early marital relationships, so those things involved here. So the factors related to the male partner, such as male involved fights among the community or workplace violence and various other violence behavior, and such as alcohol consumption, drug consumption, heavy smoking. We have come these things. They are directly related. Those are especially related to the male partners. So the previous violence. So the certain studies and even myself found. So the womenhood, child abuse and those things before the marriage and those things, or maybe even for the male partners associated child abuse, maybe comes into the risk factors. So these are the risk factors whom people are living with our society. So one even these risk factors are available, unless with these triggers it's like a silent bomb. So once the trigger factors come into this scenario, like very simple reasons, not obeying the man by the woman, arguing back and not having the food on ready on time, so not caring adequately for the children or home, questioning about the man, money, or about the extramarital affairs, going somewhere without the man's permission, refusing the man's sex, the man suspecting the woman of infidelity. These are very simple reasons, and coming to the play, there you get the violence. So as a result of this violence, the bomb explodes, you get the consequences. Fatal, suicidal by the woman, or homicidal. The woman was killed by the male partner. So those are the most serious consequences, and non-fatal conditions where we come physical health like injuries, mental health such as depression and various addictive behavior, reproductive health such as unwanted pregnancies, sexually transmitted diseases like HIV, chronic conditions, chronic disabilities, and other various comes into the play. So as judicial medical officers or the people in the health sector, we face at this scenario. So we in the society we don't involve this, neither this. So as in the hospital setups and the health care workers, we see among these cases. So then we have to have a protocol to act for these cases. So my justification, currently there is awareness about the intimate partner violence, and the government has given the special act to prevent of domestic violence, and my judicial medical officers are the people who links with this legal system and the health system to the judiciary, because they see the cases and they report to the court of law to act these cases to implement this prevention of domestic violence and punish the culprits. So the currently there is conventional medical legal examination form is available, but I propose this is used for the all injuries, starting from the road traffic injuries, other general violence. So the concentration for this intimate part violence may be less. So compare as we are using the same format for the all each and every cases. So there are specific cases, reports and forms among the field of practice, such as there's a special report to case implemented by the National Child Health Care Association. So for the child abuse, it's by the NCPA, and the sexual offences. So likewise, I propose a protocol for the medical legal action for the intimate partner violence. Currently, there is no protocol and cases. So the main objective, design and test a protocol for medical legal examination report and management of the female survivor of the intimate partner violence. So those specific objectives, I to obtain the opinion from the experts among the field all over the country, and design a protocol, and later administer this protocol, and later this protocol being tested among the victims with the opinions given by the experts, and how with the feasibility and the follow up the samples. So in my study, I broadly divide the study into two phases. So phase one, to design the protocol, that is using the expert's opinion. Phase two, test the protocol. So summary as this. So I gave the assumption, then go for the expert round, the Delphi round, and then intermediate study, and then second round, the second expert round. Then I have come to the final report and the test. This is the phase one, and this is the phase two about the study. Then about the study population, phase one, I have selected covering the entire country, 15 consultants of forensic pathologists. They are experts in the field and get their got their opinion. And the phase two, female survivors of intimate partner violence as a result of the violence, they come to the seek the judicial follow up and to the judicial medical office, Colombo South Teaching Hospital. So the ethical clearance and funding happened, and from the University of Sri Jayewardenapura, Sri Lanka. So the Delphi round threshold criteria was taken as 75%. Initially, first round I was not able to do that. The second round I got it 100%, and then I managed to do the complete the protocol. The final protocol contain 16 sections that was designed by the with the opinion of the experts among the field, that is consultant, the judicial medical officers among the ministry and the universities. So these are pages of the uh, uh, study. Can provide design protocol contain 16 sections just to apply this protocol during the examination separately with the instruction sheet. So the results, the second phase, the study was test this protocol with the patients who reported to the judicial medical office, Colombo South Teaching Hospital, and these findings were obtained as a result of application of the protocol. Just 70% of the women 21 to 40 years and 38 were unemployed. That's a very broadly summarized one of the few findings. Stated that the 80% was physically abused, 92% was assaulted by their partner, and as a result, for their follow-up, they told run away they couldn't defend, and injuries clustered to the head and face, and 98% of women sustaining a bruise or contusion. And they are later compare the main criteria I have shown here and as a table, right? These findings were obtained. They have the age and the time, and they use the weapon by the hand, and further uh, about the male partner. So the male partner age is 30 to 50 years, and the occupation, the highest machinery, elementary, and there's 80% stated during their alcohol consumption is high, and the smoking years, yeah, and further up for the management by the judicial medical officer. So they are using the protocol. The women stated like this thing. They have gone to the judicial medical officers, and they were referred this amount of cases further, like uh, gynecologist, eye referral, ENT referrals, and based on their injuries, and maybe psychiatrician, and this amount of they came to the followed up with their management, and according to the protocol they have recorded everything there. And further during the follow-up, this is also recorded in the protocol, and none of the were taken this action regarding the initial phase, and some people were summoned, and 8% percent of the cases were reported to the courts uh, based on their injuries. So then further, I questioned the medical officers who involved the protocol. They strongly agreed the protocol provide clear guideline reporting management of the managing the cases of the female survivors of the intimate partner violence. So finally, I came to the conclusion the developed protocol was applied successfully during the management of these female survivors of the intimate partner violence. So the Delphi technique was a useful tool to at the phase one of this study to develop, and the women in this group are the most vulnerable, and they are at lower high category among the vulnerability the lower categories of the employment. Blunt force are more common than sharp force like household weapons available like broomsticks, clubs, and so on. Head and upper limb injuries and lower limb injuries are the most commoner found among these injuries. So the issues about this protocol which I developed here, the limitations I found. The development protocol contained 8 pages and 16 subsections to be filled by during the medical legal examination. When used during the medical legal examination of reporting and management, it takes longer time. In fact, it took twice time, two time, like the conventional page. And the conventional has only 4 pages, and also this that has only 4 and 4 pages. Printing and handling cost is higher, and medical officers has to be given an introduction because of the application, and protocol cannot be applied unless it is tested in a larger sample before giving the country-wise application. Thank you for your attention, and any questions I would like to answer. Thank you.
Thank you very much for your nice presentation. And I have some questions from you regarding the survey sample. How many did you mentioned that got the you use a questionnaire just
Two,
from
two, two questionnaires were.
questionnaires, and then you got the data from females around 120, 120
Uh,
females.
Here, sir, I forgot to mention 100 control sample and the study sample and the control 200.
Right. So then, what did you use the methodology to analyze these data?
Uh,
What was the methodology?
I used compared to there were actually, in fact, there were no high statistical analysis involved.
Okay.
Just the Excel I analyzed.
Yes, yes.
Here the very high. In fact, it cost about 1.5 years to complete only this Delphi round. Yeah. This is directly analysis involved, comparing the analyzing the conflicts among the experts. There's not much of statistical involved.
Yeah, and then what about when you collect the data? Did you discuss with the people like family counselors? No.
In fact, it is there as a follow up here. Their section follow up plan. The protocol. I followed this group only for a period of 3 months. In fact, it is going on as the time restraint. I couldn't go much of detail about these things.
Okay, thank you very much.
Thank you, sir. Thank you for your attention.